We recognize that perinatal mood and anxiety disorders are far too common and are impairing functioning for many women across the country. And when untreated, perinatal mood and anxiety disorders can have significant clinical outcomes for both moms and for babies. We know that when depression and anxiety are under-recognized and undertreated, it results not just in clinical impairment for moms and for women, but it also results in clinical health outcomes. They're more prone to have a child that is underweight, that is born preterm, and then those babies are oftentimes at great anxiety disorders themselves as they get older. We were really excited to be able to do this analysis because we recognize that there is a shortage of mental health specialists who are experienced in caring for women with depression and anxiety in the perinatal period. And collaborative care is a real world example that is population health based. It's a team based approach to addressing mild to moderate behavioral health conditions within the primary care space. And so in this case, it allows patients to receive their care where they're already receiving the rest of their perinatal care in their OBGYN. I think this really contributes to decreasing this accessing evidence-based high mental health care. And, oftentimes when women are struggling with something like mood and anxiety disorders, it's really tough to be able to go and ask for help. Oftentimes, care as usual may look like they tell their physician that they're struggling with depression or anxiety, or maybe they score high on a question given in a clinical appointment. Care as usual is that they may be given a list of therapists or psychiatrists in the community, and then they have to go and make a call. Oftentimes, there's long wait lists if they actually get a hold of someone. So there's so many barriers to being able to receive high quality and effective mental health care. With the collaborative care model, in that same scenario, a woman can go into her OBGYN's office. She could receive a screening questionnaire, maybe score high on something that indicates that she's struggling with depression or anxiety. And right there in that office, in that appointment, she can get connected to a behavioral health care manager or a perinatal coach who can then be able to better understand what may be going on and even start some brief intervention and treatment.